I'm going to be doing your inspection today.
Okay.
Just how are you doing?
Okay. I'm fine.
Well, first of all, I want to wash up my hands and give you some privacy,
Okay.
and then we'll just do that. Well, what I'm going to be doing is just doing a, from the neck up, just doing an inspection of, a detailed inspection, just to see if we've got anything going on.
Okay.
So, obviously, you're doing okay, speech is clear, your skin looks really good. You do have one little lesion right there by your eye.
That one's a scratch, but I have one little bump. You can't see, you can only feel it.
Okay. You seem to have pretty good posture when you sit, and seem to be alert, oriented. So first thing I'm going to do is just start with your head. I'm going to work my way down, and what I'm looking for is any, and I won't mess your hair up, any kind of bumps, lesions on the skin. Sometimes whenever you're in the sun, it comes out on your skin. You can get skin cancers on your head. And then I'm looking at the occipital area because you've got lymph nodes that come down here for any kind of swelling. And we're going to feel your arteries right here. You've got temporal arteries. Now when I come down here, I want you to open and close your mouth because I'm feeling your jaw, your joint right there, that mandibular joint. Okay. And we've got sinus cavities right up here and right down here. Are you having any kind of pain?
No.
No swelling? Okay. And then I'm going to do a few eye tests on you as well. So the first one is we're going to check your peripheral vision. So I'm going to put my hands back here, and then whenever you see them come in your peripheral vision, let me know.
Now.
Very good.
Now.
Better than my last section.
Now.
Very good. And then the next thing I'm going to do is we're going to check your cranial light reflex. So I'm going to shine a light, and I want you to just look straight ahead and not at the light. Very good. What I'm looking for is symmetry on the light. The next thing we're going to do, if I had, we're using the otoscope, we're going to check for a red reflex. If I were to get really close with this particular instrument, I would expect to see red in both eyes, and that's just a refraction of the light bouncing off. So we're also going to check some cranial nerves here. What we're checking for is your 8, 9, and 10 cranial nerves. And so what I want to do first is have you wash my finger. Very good. Okay, the next thing I'm going to check for is I want to watch your eye. I'm going to have you cover one of your eyes, and then we could use a piece of paper or anything, but in this instance we're just going to use your hand. And whenever you release your hand, I would expect your gaze to remain. So anytime you want to take your hand away. Very good. Try the other eye. Good. Well, it looks good. And then what I'm looking for in your eyes is basically, is there any redness in the sclera of your eyes? And they look clear. And then when we pull this down, we're going to be looking for any redness or any drainage in the conjunctiva, and not seeing anything, and you're not having any problems?
No.
Okay. I'm looking at, you've got good color eyes, they're nice and brown. Everything looks clear. I'm not seeing any yellowing, any distortions or anything like that. Are you having any visual problems right now?
No.
Okay. I want to check also your pupils, make sure they dilate properly. Very good. What I'm watching for is both eyes. I'm watching for a response from the other side as well. Okay, good. And then to do a visual exam, what we call a Snellen chart, I'm going to stand about 20 feet away, and then I'm going to have you read the top line, or the if you can. If you can't, go to the next line that you can read.
E, E, P. Do I go down?
No, that's okay.
I can do
Basically, I just want to know that you can do that. So the next thing we're going to be looking at is your nose. So I'm going to actually be looking at the symmetry of your nose, which is good. And then we're going to move down it. If you were to put your finger on one nair at a time, are you able to breathe? Okay, any drainage or anything?
Oh, a little clear drainage off and on, but that's, I
Okay.
usually get that in the spring.
And so the next thing I want to do is just make sure that the mucosa looks good and that you're not having any swelling. Your septum's moved a little bit over to the right, but it looks like your turbinates are not swollen or anything. So it doesn't appear to have any
No.
nasal congestion. Okay. So that looks good. Next thing we're going to move on to is your mouth. And I'm going to put some gloves on for this because I actually want to look at the inside of your mouth.
Okay.
And are you having any dental issues right now?
No.
So we're going to look at your teeth. And then what I'm looking for here is any kind of sores, any kind of lesions in the mouth. And that looks good. And then I'm going to shine my light in here and I'm going to look at your tonsils. So open wide. And we're going to use this, so this would be a good time to test your gag reflex.
Yeah, I have one.
If you gag pretty easy, because I'm going to be looking at your tonsils. I want to be able to tell, are they at grade 1, 2, or 3? And yours look okay. They're at grade 1. Uvula is nice and midline. Mouth pink, moist. Doesn't appear to have any problems there.
Okay.
And then what I want to do is check your, I want you to stick out your tongue, and then we're looking again for a cranial nerve function. Go back and forth with it. Very good. Okay, then we just move on down to the neck. What I'm going to be doing is checking on your carotids. What I'm looking for is any kind of a pulsation that shouldn't be there. And there's no masses, no symmetry's good. And I'm also checking for your lymph nodes too, because you have lymph nodes that come all the way down through here. And I'm looking for any kind of swelling. Any pain? And there's no distension. I'm just feeling for your pulse. Also then I want to look at I want to feel for your trachea. And additionally, I want to note any kind of abnormality and swelling of the thyroid. And it appears to be good. Are you able to turn your head from side to side without any difficulty? Okay, I'm going to put pressure on this side, and I want you to turn your head into it. Good. Again here. Good. Everything appears to be okay. Looking great. Any questions?
Nope.
All right. Thank you.